In the late 1820s, Dr. Samuel Hahnemann had proven his medical framework against some of the most aggressive pathogens of his era. His homeopathic methods rapidly cured sudden acute infections, like typhus and the old smooth scarlet fever of Sydenham. Yet, these exact same methods failed when applied to non-venereal chronic diseases. Early treatments created a deceptive loop. The remedies temporarily relieved the patient's symptoms, but the disease invariably returned. When it did, it mutated, presenting in a more obstinate and threatening form than before. A perfect diet did not matter, nor a robust physical constitution, nor strict lifestyle regimens. These chronic ailments relentlessly worsened over the patient's entire lifetime. This persistent failure triggered a realization. Hahnemann concluded that physicians were losing because they were treating isolated fragments of a disease. They were attacking individual manifestations rather than the deep-seated original malady driving them. The existing medical models were structurally inadequate for long-term illness. To actually cure his patients, Hahnemann began building a unified theory of chronic pathology. He proposed a radical thesis. 7/8 of all non-venereal chronic maladies shared a single hidden origin. He named this ancient universal miasm psora, the internal itch disease. Hahnemann traced a massive array of internal failures back to this single infection. He linked it to severe respiratory conditions, including violent asthma, empyema, and sudden attacks of suffocating catarrh. The miasm's reach extended into the nervous system. He documented its role in causing sensory collapse, like amaurosis and deafness, alongside profound psychological and neurological manifestations, ranging from severe melancholy to epilepsy. Psora even corrupted the body's physical architecture, driving deep structural deformities such as caries of the bone, sarcomatous tumors, and curvature of the spine. These seemingly unrelated symptoms form a single cohesive biological entity. The root system of psora feeds a vast canopy of disparate localized diseases. This reclassification consolidated thousands of isolated medical diagnoses into symptoms of a single biological source. To understand how psora became so ubiquitous, Hahnemann traced its lineage back thousands of years to its ancient presentation as leprosy. The extreme, disfiguring visibility of ancient leprosy acted as a natural barrier. Its appearance forced the social isolation of the infected, which severely limited its transmission. This dynamic shifted during the Middle Ages. Returning crusaders introduced refined hygiene practices to Europe, including more frequent warm baths and the use of clean cotton garments. By mitigating the external horrors of the disease, increased hygiene shrank the visible symptoms from full-blown leprosy down to a common, easily concealed skin itch. By becoming less visible and horrifying, the miasma was easily ignored. Patients hid their infections, allowing psora to become more contagious and spread silently. When patients presented with this common itch, the standard 19th century allopathic medical response was aggressive. Physicians applied topical zinc, lead, and sulfur ointments directly to the skin to destroy the eruption. This protocol relied on the assumption that the skin eruption was a purely localized external ailment with no connection to the internal organs. This diagram demonstrates Hahnemann's concept of suppression. When an external chemical destroys the skin eruption, it removes the body's vicarious exhaust valve. With the surface outlet sealed, the active miasm deflects inward, traveling through absorbent vessels and taking root deep within the internal organs. Hahnemann backed this mechanism with extensive clinical records. He cited the 1750 observations of Dr. Ludwig Christian Juncker, who documented that suppressing the itch in young people directly resulted in fatal phthisis. He pointed to Dr. Pelargis's clinical logs, which demonstrated that the external removal of tinea capitis was immediately followed by suffocating catarrh and violent asthma. He referenced Morganier's autopsy reports, which proved that patients whose itch had been driven inward died with their lungs completely filled with cysts of pus. Despite historical warnings, 19th century physicians dismissed their patients as completely cured the moment the skin cleared. The suppression of the body's natural exhaust valve inadvertently engineered a continent-wide increase in severe, intractable chronic disease. To fight this embedded miasma, Hahnemann looked to the body's internal biological battleground, the vital force. The primary function of the vital force is to maintain organic health. It successfully fights off transient acute diseases by producing a biological crisis that expels the threat. But this system has a critical vulnerability. Against a slow-moving chronic miasm like psora, the vital force can only mount a weak resistance. Without external aid, the vital force is neither capable nor destined to overpower a chronic foe. It will continuously lose ground until the organism dies. To cure psora, the physician cannot rely on nature alone. They must engineer a superior artificial force to compel the failing vital force into action. Hahnemann's pharmacodynamic solution was to introduce an artificial homeopathic disease into the body. This simulated the original foe, forcing the vital force to increase its energy to fight the new perceived threat. This requires correcting a common misconception. Hahnemann explicitly rejected the concept that his medicines were mere dilutions, where the active ingredient simply fades away. On the left is standard dilution. A substance dissolves into water, slowly fading into a completely clear, powerless liquid. On the right is Hahnemann's actual method, dynamization. By applying sharp kinetic impacts, the crude matter shatters, releasing the latent medicinal properties trapped within. Achieving this state required strict physical engineering. Hahnemann demanded exactly 10 violent successive strokes against a hard, elastic body. These historical tools, the apothecary chest, glass vials, leather pouches, and brass pestle, were used by the homeopathic physician to manually forge these potentized remedies. Dynamization uses mechanical force to activate the latent kinetic energy of a medicinal substance. The final stage of the cure involves administering this highly potentized remedy to the patient via a split-dose watery solution. This method is dictated by a strict biological law. Hahnemann observed that the vital force will never calmly accept the exact same unchanged dose of medicine twice in succession. Repeating a static dose neutralizes the effect of the previous one, impedes recovery, and actively spawns a new medicinal disease. To bypass this biological rejection, Hahnemann engineered a mechanical adjustment. The physician must physically shake the watery solution exactly 5 or 6 times before administering every single dose. This diagram illustrates how those impacts work. By shaking the solution, the kinetic energy shifts the medicine's degree of dynamization, just enough to bypass the body's rigid defense threshold, tricking the vital force into accepting it. By identifying the biological mechanism of psora and the operational limits of the vital force, Hahnemann used kinetic impacts to engineer medicines that forced the body's internal defenses to respond.